Or let's talk in detail about BBL, which stands for Brazilian butt lift, one of the most famous cosmetic surgery procedures in the world. Here's the long story of how it started, who created it, and how it works. What is a BBL? BBL, Brazilian butt lift, is a cosmetic surgery that reshapes and enlarges the buttocks using a person's own body fat. Instead of using implants, doctors take fat from parts of your body where there's extra, like the belly, thighs, or back, clean it and inject it into your buttocks to make them rounder and lifted. So it's both a fat removal and a body shaping surgery at once. How it all started. The origin of the BBL goes back to the 1960s and 1980s, when doctors began experimenting with fat transfer, or also called liposculpture. At first, surgeons used this method to smooth out scars or fill small areas in the face or body. But the modern Brazilian butt lift, as we know it today, was developed by Dr. Ivo Pitangui, a famous Brazilian plastic surgeon from Rio de Janeiro in the 1960s. He's often called the father of modern plastic surgery. Dr. Pitangui believed that beauty should look natural, not fake or plastic, and that a person's own fat could be used to enhance their body safely. He started doing early versions of fat grafting to make the buttocks look rounder and shapelier, especially for Brazilian women who admired a curvy body shape. 3. Why it's called Brazilian. The name Brazilian butt lift comes from Brazil because Brazil has long celebrated curvy, natural-looking bodies. Dr. Pitangui's work made the country famous for cosmetic surgery. The look itself, lifted, round and full, reflected the Brazilian ideal of beauty. The name BBL became popular around the 1990s, especially after American celebrities and models began flying to Brazil for surgery. 4. How it works, step by step. A BBL has two main parts. Step 1. Liposuction. The surgeon removes extra fat from certain areas, usually the abdomen, waist, lower back, or thighs, using a small suction tube. This not only collects the fat, but also sculpts the body, making the waist smaller. Step 2. Fat purification. The fat is cleaned, filtered, and processed so that only healthy fat cells remain. Step 3. Fat injection. The surgeon carefully injects the purified fat into different layers of the buttocks using thin cannulas, tubes. This creates a natural, rounded shape. Doctors use special techniques to avoid injecting too deeply, which could be dangerous. Rise in popularity. The BBL became extremely popular in the 2010s, mainly because of celebrities like Kim Kardashian, Nicki Minaj, Cardi B, Jennifer Lopez. Social media, especially Instagram, helped spread the BBL trend worldwide. It became a symbol of the hourglass figure, big hips, small waist, and round buttocks. Now 6. Risks and safety. Though many people love the results, BBL surgery has also been controversial because it carries serious risks. In fact, in its early years, it was considered one of the most dangerous cosmetic surgeries because fat could accidentally enter blood vessels and cause a fat embolism, which can be fatal. That's why doctors today use safer techniques, inject fat only in the upper layers of tissue, and monitor patients closely. 7. Modern improvements. In recent years, new technology and surgical methods have made the BBL much safer and more natural looking. Use of ultrasound guidance during injections, better fat purification systems, focus on skinny BBLs, more moderate athletic looks. Surgeons now train specifically for BBL safety. 8. Summary, part detail. Full name, Brazilian butt lift, invented by Dr. Ivo Pitangui, first developed around 1960s to 1970s. How it works: removes fat via liposuction, purifies it, and injects it into the buttocks. Goal: to create a fuller, rounder, and more natural-looking butt shape. Famous for natural results using your own fat, risks infection, fat embolism, asymmetry if not done properly. Now, all right, let's dive into the long story of Dr. Ivo Pitangui, the man known as the father of modern plastic surgery. Early life and background. Dr. Ivo Heltio Jardim de Campos Pitangui was born on July 5, 1926 in Belo Horizonte, Brazil. His father was also a surgeon, and that early exposure to medicine inspired him deeply. From childhood, Pitangui was fascinated by how surgery could heal not just the body but also the spirit of a person. When he was a teenager, he saw victims of severe burns and injuries who felt ashamed of their scars. That experience planted in him a lifelong mission to help people regain both their appearance and their dignity. Education and training. Patangui studied medicine at the Federal University of Minas Gerais and later moved to Rio de Janeiro to continue his studies. After finishing medical school, he travelled to Europe to train under some of the best surgeons of his time. He worked with Sir Archibald Mackindoe in England, who treated burned Royal Air Force pilots during World War II, and Harold Gillies, known as the pioneer of plastic and reconstructive surgery. These experiences shaped Patangui's surgical philosophy that reconstructive and aesthetic surgery are two sides of the same art. Turning point, the 1961 circus fire. One of the defining moments of his life came in 1961, when a catastrophic fire broke out at the Grand Circus Norte-Americano in Niterói, Brazil. More than 2,500 people were burned or injured, and hundreds died. Dr. Patangui volunteered to treat the survivors. For weeks, he worked almost without rest, performing countless operations to save lives and reconstruct faces and bodies. This tragedy showed him how surgery could restore hope and humanity, even to those most devastated. After this event, he said, open quote, "Beauty is not a privilege of a few, it is a right for all who desire it." Close quote. Founding the Patangui Clinic. In 1963, he opened the Clínica Ivo Patangui in Rio de Janeiro. It became one of the world's most famous centers for plastic surgery and medical training. Doctors from all over the world came to study under him. His techniques combined precision, aesthetics, and compassion, emphasizing natural beauty over artificial appearance. He trained more than 500 surgeons from over 40 countries, many of whom became leaders in their own nations. Philosophy and contributions. Dr. Patangui believed that plastic surgery was not just about vanity, it was about psychological healing. He often said, open quote, "The search for beauty is a natural instinct in human beings," close quote. His work bridged the gap between aesthetic surgery for beauty and reconstructive surgery for trauma, burns, or birth defects. He developed many innovative surgical techniques that are still used today in facelifts, breast reconstruction, abdominoplasty, tummy tuck, burn repair, and scar treatment. He also taught that doctors must treat the whole person, body, mind, and emotion. Fame and cultural influence. Dr. Patangui became an international figure. Celebrities, royals, and political leaders from around the world traveled to Brazil to have surgery with him. Despite his fame, he remained humble and committed to teaching. He was often called the Michelangelo of the scalpel. He also wrote many books and scientific papers, and he became a member of several global medical academies. His clinic became a place of medical excellence and a symbol of Brazilian skill and beauty. Later life and legacy. Dr. Patangui remained active into his 80s, both performing surgeries and teaching new generations. He died on August 6, 2016, at the age of 90 in Rio de Janeiro, just one day after carrying the Olympic torch for the 2016 Rio Olympic Games. That was a fitting farewell for a man who had carried the torch of compassion and innovation all his life. Legacy to today, his name stands as a symbol of artistry in surgery, human empathy, and Brazilian excellence. He transformed the image of plastic surgery from vanity to human restoration, giving thousands of people a new chance to live with confidence and dignity.